Hello and welcome to my YouTube channel, a channel that simplifies medicine. Of course, it's not an alternative to going to medical school, but at least you'll be able to learn a lot that ordinarily may look very challenging. So welcome. Today I'll be speaking to you about pyelonephritis. What's pyelonephritis? Pyelonephritis simply means an infection of the kidney. Before you watch this video, I would strongly suggest that you watch the video on urinary tract infection, UTI, where I explain a number of terms that will still be used here, but will make things a lot easier if you could do that. So, what is pyelonephritis? I've just answered that, which is infection of the kidney. And for us to have a good grasp of that, we need to just quickly mention the anatomy of the urinary tract. Just picture in your mind's eye, you have the kidneys on each side of the body, and then they come down through the ureter. Ureters, that's on each side will be ureter bilaterally, and then you come into the bladder, which is like the collecting of the tank, and then you have a tract through which the urine goes out of the body, called the urethra. So kidneys, ureters, bladder, and urethra. Infection could occur by an organism finding its way to the urinary tract, that is the urethra, and then tracks upwards. We've discussed urinary tract infection, like I've said, and I would advise strongly that you watch that video. So, what causes kidney infection? The first and the most obvious will be if a patient has a urinary tract infection, the organism can track upwards through the urethra to the bladder and then through the ureters to the kidney. So if that occurs, we have a patient that is presenting with urinary tract infection that turns out to become a kidney infection called pyelonephritis. That is just one way. Another way that this could occur is if a patient has an infection in the blood. That infection could also spread through the blood, via the blood to the kidneys, what we call hematogenous spread. Another way this could occur is if a patient has an indwelling catheter. A catheter is a tubing that is passed through the urethra into the bladder to take the urine that is in the bladder out of the body. Whenever you have a foreign object, foreign body in the body, that becomes a nidus, becomes an opportunity for organisms to grow around that foreign body. And so if you pass a urinary catheter, that becomes an opportunity, a nidus for infection to occur. Also, if there is urinary tract infection, this urinary tract obstruction, I should say, could occur from kidney stones or an enlarged prostate. Whatever slows or impedes the flow of urine through this tract presents an opportunity for an infection to occur. If there's a weakened immune system, for example, patients that have diabetes, that have retroviral disease, HIV, that could also be a problem resulting in pyelonephritis. And then being female is also a risk factor because, like I explained previously in the other video, the female's urethra is shorter than the male's urethra, and so the consequence is that there's a stronger predilection to developing urinary tract infection than in males, and by that same reasoning, that same correlation, females are more likely to develop pyelonephritis than males. Pregnancy is a risk factor here because in pregnancy, there's a high level of progesterone, which is a hormone that causes relaxation of smooth muscles and so reduces peristalsis. Peristalsis is the wave-like movements that allow for propulsion, for movement along the tract. So if there is a slowing of that movement, it creates an opportunity for infection to occur. And then carrying out procedures such as a kidney biopsy. When a patient has a kidney biopsy, of course, a lot of precaution is taken to avoid an infection, but it remains a risk. What are the symptoms that patients could have when they have, for a patient that has pyelonephritis? The features that occur in urinary tract infections, such as frequency, nocturia, dysuria, hematuria, I've explained this, but just to run very quickly, what are these terms? frequency when you have to pass urine more frequently than usual, nocturia if that occurs at night, dysuria if there's pain or stinging sensation when you pass urine, hematuria when there's blood in urine, pyuria when there's white cells in the urine or pus in the urine. So these features are called urinary tract infection. But of course, if the patient has urinary tract infection, it simply means that the patient is at risk of developing pyelonephritis. Other symptoms will be fever, chills, nausea, vomiting, and flank pain. So you find that the patient has pain along the side, the flank, what we call the flank, or in medicine we call renal angle tenderness, when just a simple pressure or thump at the back causes quite some pain, called a renal angle tenderness, but the patient will explain that he or she has flank pain. What are the investigations we carry out? Investigations such as urinalysis. So in urinalysis, that could detect a patient that has urinary tract infection. And then we could also go ahead to do what's called the urine microscopy culture and sensitivity, where we'll be able to detect the exact organism and then the particular antibiotic that will be antibiotics that will be used for treatment. And then the urine MCS or urinary microscopy culture and sensitivity could also pick up white cell casts. Imaging, this could be a renal scan, as a kidney scan, or a CT scan. And then we could do a very basic investigation called the full blood count, where we would find that the white cell counts, which are the soldiers of the body, they ward off infection, and they could be raised in patients that have pyelonephritis. And then the inflammatory markers such as ESR, that is erythrocyte sedimentation rate, or the CRP, which is the very sensitive marker that could be that could detect infection, would also be raised. So the ESR, CRP are called inflammatory markers, C-reactive protein. How do we treat these patients? Treatment is primarily antibiotics. A number of patients could use oral antibiotics, but mind you, these patients, some of them are already vomiting, some are nauseated, so it may be necessary to give parenteral, or say parenteral in medicine, we mean giving injections either through the vein or through the muscle. So parenteral antibiotics. And then if the patient is pregnant, that poses a greater risk, and so such a patient will require parenteral antibiotics. And then analgesics. Remember I mentioned that the patient will have flank pain, and so with flank pain you need to administer analgesics such as paracetamol or opioids. Now, it's very critically important, I mentioned here, that when patients have an infection in the kidney, that's not the time to take non-steroidal anti-inflammatory drugs such as ibuprofen. And the other thing you can do for yourself when you have any urinary tract infection or pyelonephritis will be to adequately hydrate. Drink as much water as possible. So in this video, we've discussed pyelonephritis, which simply means an infection of the kidney. We've discussed reasons why people could be predisposed to developing pyelonephritis. We've also discussed how to investigate and the treatment, which is primarily antibiotics. If you've learned something, like, share, and subscribe.